In today's class, we are going to discuss one topic, that is impedance plethysmography. So first, I will talk about what is meant by plethysmography. So plethysmography is an instrument where you can measure or you can record the volume changes of particular area. Okay, so this particular technique is being used in two area of application, like for example, if you want to measure the respiration rate, your chest. Okay, if you place the device over your chest, based on your chest expansion and relaxation, your volume of your chest, okay, it's changing, right? So based on that volume change, you can measure how many times the patient is taking breath. So in this way we can measure easily what is the respiration rate. In second application is like you can use to measure the blood flow. What is the velocity of blood flow? Whether you have any block in the blood vessels or not, like that you can easily identify by applying this technique called measuring volume changes, because we already know that in our circulation the blood follows pulsation mode. So you will having the keep on like blood volume changes you can see in the blood vessels, right? So for each and every bit your blood is like your blood vessels will follow contraction relaxation, which in turn makes the changes of blood volume and also the blood vessels. These changes, if we can sense by using technique called plethysmography, we can easily identify what is the density of blood flow, or what is the density of blood, what is the velocity of blood flow. So this kind of inference we can easily identify if we know what is the volume changes is happening over there. So that is the main technique we are going to discuss is today, is all about plethysmography. So what is the different kind of application you can see in this plethysmography is like first one is atrial obstruction. As I said before, it is mainly used to assess the blood circulation. In that, first application is atrial obstruction. Second is pulse wave velocity measurements. So wave velocity measurements especially meant to record what is the flow of blood. So in this way you can easily identify the density of blood, whether you need blood thinner or blood thicker, so based on the condition of particular persons. So these are the different applications where you can use the plethysmography widely. Okay, so we have different techniques in order to implement or use this plethysmography. Like you can measure these volume changes. For example, you can use pressure transducer, or you can measure the volume changes by using capacitive transducer or strain gauge, photoelectric method, or impedance plethysmography. So compared to this, all are good in measuring volume changes. That is the plethysmographic technique. But here I have going to take one particular technique to be discussed further in this class, that is impedance plethysmography. How this impedance plethysmography technique is helpful to measure the blood flow is that is the today's topic. So first we will start about what is mean by impedance plethysmography. So otherwise we can call it as IPG. Okay, so IPG is an one kind of non-invasive medical test which is meant to measure the changes in electrical resistance of the chest or cough or other regions of the body. Okay, so this technique is what it's going to do means it's going to measure the changes in electrical resistance of where you are going to place the electrodes. Okay, so by means of that which in turn you will going to measure what is the blood volume changes, okay, which directly or indirectly going to indicate the presence of or absence of any critical conditions like cardiac obstruction or venous or atrial pathology and so on. So this particular procedure is an alternative or substitute to the technique called venography, angiography, which is an invasive method. Okay, so if you take venography, angiography, these are invasive method where you have to make incision to send the device to make a assessment of blood flow. But here we are just going to follow non-invasive method. Here we are not going to make any incision kind of thing. So just we will going to assess the what is the blood volume changes, which in turn give the inference about any pathological or physiological indications over there. Okay, so let's see what is the principle. Okay, so if you take the principle of this impedance lithosmography is very simple. Okay, it just follows the Ohm's law. You know, Ohm's law is equal to V is equal to IR. Here we are going to what we are going to measure here. Here we are going to measure change in resistance. That is the thing we are going to assess here. Okay, so that change in resistance here speaks about our skin resistance, where you are going to place the electrode. Okay, so when you are having change in resistance in one hand, and then you are going to give constant current. Okay, so whenever the constant current flows over the resistance, you can see some voltage drop. Okay, that voltage drop is based on what? The value of the resistance. Okay, so based on that value of resistance, you can see some voltage drop whenever you pass the constant current. So in this principle, we are going to follow what we have a change in resistance, that is the area, that is the part we are going to assess. For that we are going to send some constant current. So whenever the constant current strike the resistance, that you can see some potential drop. That potential drop which in turn says about what is your change in resistance. Okay, so if you have 5 volt, for 5 volt what is the change in resistance, because we know what is the constant current. The output we will get some voltage drop, that you get to know what is the output of voltage, either 5 volt or 6 volt or somewhat. Okay, so now you know the value of what is the current value, constant current value, and you know the value of what is voltage value. When you substitute these two, then you can come to know what is your resistance value, that is our area of interest. Okay, so now next part is how this change in resistance will interlink with your blood flow. Okay, so how they are interlinking these two technical different components. You know that the blood is very good conductor of electricity. Okay, so that is like then the blood is inversely proportional to what? Your resistance, that is your electrical impedance. Okay, so whenever you have a pumping action, your blood is like start to flow, right, in blood vessels. So whenever the blood flow is high, automatically your skin resistance will change accordingly. Whenever the blood flow is less, your skin resistance will change according to that. Okay, so the thing is that you have, when you have very more blood, blood is like you have very good conducting property. So when it is blood vessel is flooded with so many blood, that is during during lax contraction, the blood vessel now it's been accumulated with what, so much of blood, so that as a result you can see some kind of changes in skin resistance. Because the high blood, you have high conductance, as a result you will your skin have low resistance property. Similarly, in next stage, when it comes to relaxation state, your blood flow is now become normal. Okay, so your density of blood is now it's been reduced. As a result, the conducting property of the blood is also reduced. Then which in turn reduce the increase the impedance of the skin. So there you can see some kind of impedance changes according to the blood volume changes. So in this way you can correlate change in resistance with blood volume. Okay, so in this through this manner we will easily find out what is the blood volume changes. From this blood volume changes we can easily assess whether we have any block, any obstruction in the atrial or venous and so on. Then if we have found out any kind of such things, any abnormal things, then we will go to, or then we will move on to the next process. So this how this principle of lithosmography will work. As a continuation of this, in next class we will deal with what is the techniques which is being followed to measure the impedance lithosmography. Thank you.